then you'll want to order your kit and get those tools directly to help get the best possible care. So this slide is showing kind of across medicine, when it comes to care transitions, the focus is generally on people moving from a hospital back to their home. So managing the discharge, the proper care that is needed at home, preventing readmission, etc. But in Parkinson's, really it's the opposite that is more true. The focus needs to be on the potential transition from home to hospital. And why is that? Hospitals are safe, right? These are all very reasonable statements that we would hope would be true. They will call my neurologist. Staff will understand the Parkinson's symptoms. They will know the drugs that are unsafe. I think you probably know there's a but coming here. This is an example of a study that looked at medication discrepancies at the time of admission in people with a variety of medical conditions. So again, this is not just with people with Parkinson's, it's all different conditions, all different types of medications taken. So this means when you're admitted to the hospital and asked what medications you're on, they give you the wrong dose, or they forget to give you a drug, or give you the wrong drug. And you can see here the class 1, class 2, and class 3 discrepancies. So class 1 discrepancies are unlikely to cause any discomfort or, quote, clinical deterioration. Class 2 can cause moderate discomfort, and then class 3 discrepancies are really severe. They have potential to cause severe discomfort, severe clinical impact. And one of those most severe cases in this study happened to be someone with Parkinson's, and we know that because they were taking levodopa-carbidopa. And their frequency of medication was changed. They entered the hospital and they were being dosed 3 times a day, and then they got to the hospital and were admitted, and they switched the dose to 2 times a day. And as you all probably know, that can have a huge impact on someone's Parkinson's symptoms. And so it's recognized across medicine the really severe impact that these medication changes can have, and the importance of medication timing and the proper medications for people with Parkinson's disease. So at the Parkinson's Foundation, we've been focusing on this issue, on Parkinson's and hospitalization, for at least a decade now, and we've found that even in the very best Parkinson's centers, so we have a network of 42 centers of excellence around the world that provide high quality care and perform cutting edge research on Parkinson's. Mostly they're academic medical centers with interdisciplinary care teams, so not just neurologists, but they're working with speech language pathologists, occupational and physical therapists, social workers, whole teams devoted to improving care for people with PD. And 2 of our centers are actually in Ontario, the University of Western Ontario and Toronto Western Hospital. But even at these best centers, many people with Parkinson's are not getting their medication on time in the hospital, or are getting medications that are unsafe, because you can have your Parkinson's clinic, but if people are getting admitted to the emergency room, that's a completely separate unit from the Parkinson's and Movement Disorder Center. So here are some numbers to kind of put all of that into stark perspective. So every year, 1 in 3 people with Parkinson's is hospitalized for whatever reason, again, whether it's a planned visit or an emergency. Out of that 1 in 3 that are hospitalized, 3 out of 4 of those are not getting their medications on time, are getting the wrong medications. And of those, 2 in 3 have severe complications because of it. So it's a very serious issue. And here are the numbers to go along with that. If we say out of 100 patients, 16% of people admitted to the hospital with Parkinson's every year are getting serious complications because of issues with incorrect medications. So that's serious issues and a big number. So in addition to that, in general, there are just higher risks for people with Parkinson's when it comes to the hospital at all. People with Parkinson's are admitted more often than similar people without Parkinson's, so kind of age-matched people with Parkinson's tend to be hospitalized more and tend to have longer hospital stays by an average of almost 4 days, 3.5 days more. But actually, only 15% of those admissions are for Parkinson's. So if you look at that reasons for admissions list, down at the bottom, Parkinson's related is that 13%. It could be injury or an infection or GI or cardiac issues that are the actual cause of the hospitalization. But because of the risks related to medication timing for people with Parkinson's, those visits end up being longer and can be more complicated. You can see there on the bottom right, the Parkinson's versus controls, that people with Parkinson's have a higher risk of hip fracture and UTIs in particular, things that have nothing to do necessarily with their Parkinson's, but that can just increase the risks when it comes to a hospitalization. So what does this mean for people with PD in the hospital? Basically, hospitals can be a dangerous place. You think most people think that hospitals are where you go to get well, but for people with Parkinson's, unfortunately, it can sometimes be the opposite. And of the complications experienced by people in the hospital, that top one there, confusion, is particularly troubling, because most of the medicines typically used to treat confusion in the hospital are not safe for people with Parkinson's. So various antipsychotics are the go-to for patients with confusion, but most antipsychotics act by blocking dopamine, which can have severe consequences for people with PD. I'm sure you're all aware, lack of dopamine is a reason for the motor symptoms and a lot of the non-motor symptoms involved with Parkinson's. So if you're given a medication that blocks dopamine, that can severely impact your ability to move. And we've had calls from the hospital or after a hospitalization, really sad, traumatic stories from people. One example is, he was doing fine when when he was on, when his medications were working, he was up walking the halls, and later, as he was experiencing a little bit of off time before his next dose, he called the call button for the nurse to come help him use the bathroom, and the nurse ignored it and was busy with other patients or didn't come on time, and the person ended up soiling the bed. And when the nurse came, she said, you were fine before I saw you walking down the hall. You didn't need my help. And he said, stay here, give me my medication, come back in 30 minutes and see the difference, because she saw how he could not move at that time and what a difference the medication made in his ability to just be. So that's something we actually are including now in these aware and care kits and recommending to show. Telling is great, but show, if you're having that off time, tell the nurse, tell the staff to come back in half an hour and see the difference that it really does make. So anyway, now that I've properly scared you and talked about some of these horror stories that we've gotten, let's change gears to how we can change those outcomes. And the bottom line for the Aware and Care Kit is the right medications on time. So I need my meds on time, every time. That little asterisk is no contraindicated medications. So, no medications that are unsafe for people with Parkinson's, and hopefully your exact medications. We've found that many hospitals don't stock every single Parkinson's medication. So, if you come in on one, they might want to switch you to a different brand or a different version, and you want the same medications that have been working for you on time, every time. So this likely you already know, but a lot of people who aren't familiar with Parkinson's, who maybe just think of it as that disorder where people shake, who don't know the full spectrum of symptoms and the full spectrum of impact, I think people are more familiar with and understand the issue of insulin for people with diabetes. And so this, I think, is a powerful statement to tell someone that the anti-Parkinson medications are as necessary to someone with Parkinson's as insulin is to a diabetic. So for all of these reasons, back in 2011, the Parkinson's Foundation launched the Aware and Care campaign to help people with Parkinson's and their families and caregivers be your own advocate. So the kit contains lots of information, which we'll get into in a little bit, to help educate you and to help give you the language to speak for yourself when you're in the hospital or another care setting. And it also contains the materials to help educate any providers and others you encounter in a hospital setting. So, you know, again, back to that kind of myths, the hospital is a safe place, right? We would think that anyone you'd encounter would be familiar with Parkinson's and would know all of this information already, but really, they're probably not encountering all that many Parkinson's patients in the course of their job, and there's really not a lot of Parkinson's education at all. You know, maybe they'll get a couple hours in med school, and so it's really important for the people with Parkinson's and the people around them, families and caregivers, to be confident speaking up and being advocates for your own care. So I mentioned that, you know, even in the best hospitals, even in our centers of excellence, people were not getting their meds on time. And this was a survey that was done of those centers of excellence. And we found that hospital neurologists were not confident in the care that their patients were getting in other portions of their hospital. So obviously, when you're in your Parkinson's and Movement Disorder Center, seeing your neurologist and all the PD specialists, they know what's up, and you're getting your meds on time. You're getting all the right recommendations. But these questions were about, you know, how confident are you that non-neurologists caring for people with Parkinson's in the hospital know about Parkinson's care? And they were not at all confident that non-neurologists knew about contraindicated medications, safe antipsychotics, or the importance of medication timing. So you can see here, how confident are you that they know that these two drugs make PD symptoms worse? So the first one, metoclopramide, is an anti-nausea medication. You might have heard of it. The brand name is Reglan. And then the other is an antipsychotic with the brand name Compazine. And over here, the percentage who were confident that non-neurologists knew about those risks was very low. And again, you know, how confident were they that people knew that these two drugs are the safest antipsychotics in PD? Again, not confident at all. And finally, the confidence around medication timing, unfortunately, was also quite low. So again, even at the very best centers, there can be risks for people with Parkinson's. So this chart is in basically every piece of the Aware and Care kit. It's on the PD fact sheet, it's on the medical alert card, which I'll review in a little bit, but this shows in a snapshot those medications that may be contraindicated in Parkinson's. So over here, our blue column are the meds that are safe. And here, this is the contraindicated medications list from the US. So pimavanserin was approved last year to treat Parkinson's disease psychosis, but only in the US for now. So right now, people with Parkinson's elsewhere, if an antipsychotic is needed, should take Seroquel or Clozaril. And all other antipsychotics pose a great risk. Again, a lot of these nausea and GI drugs, some of them act in the same way, act on the dopamine channels, and so interfering with the dopamine pathways can have severe consequences. So this contraindicated medications sheet is helpful to be familiar with. Obviously, you're not going to memorize every single long name, not even the shorter brand names, but to kind of be able to glance it over and familiarize yourself with those that are safe and those that are not. Again, another example, we had a patient call up from the hospital because her doctor wanted to give her Demerol. And she said, no, I don't think so. And he was going ahead, and she got out her Aware and Care kit that she had brought to the hospital with her and showed him that Demerol was not safe. And he said, oh, okay, I guess you're right, and switched to a different medication. So it's very important to at least familiarize yourself with this. And if you have a question, if you're not sure, double check what you're being prescribed and reference it with this sheet. She actually called us and was requesting more reminder slips so she could have them on hand to give out to everyone who came into her room at the hospital. So this is our Facebook page. We get lots of comments all the time, people sharing their stories. Whenever we do post about hospitalization, we get lots of feedback. And unfortunately, we get lots of horror stories. I heard from Lisa that it's the same for the Parkinson Society, Southwestern Ontario, that constituents call up, and too frequently the stories about hospitalizations are negative, that the nurses didn't want to listen or that they didn't know about the medication timing. So we get a lot of this feedback. You can see here, these are two stark ones, dramatic cases. And our goal with the Aware and Care Kit is to try and reduce the number of these such cases. Here are just a couple other positive examples on the flip side from people who have gotten their Aware and Care Kits, familiarized themselves with it, and brought it to the hospital, and have been able to have real dialogue with their doctors. The anesthesiologists thanked them for being prepared, for providing information, and for asking those questions. This is the one I mentioned before. The doctor was about to give Demerol, and she looked it up and saw that it wasn't appropriate, and so they switched course to something that was better. These are from our helpline, which we have people from Canada are welcome to call. Unfortunately, we cannot ship any of our materials to internationally, and that's why we're so happy to have this partnership so that people in Canada can get the Aware and Care Kits. This one was from a survey we did a couple years ago of all the people who had ordered Aware and Care Kits, and we found this particularly interesting, that if you remember from before, about 1/3 of people with Parkinson's are hospitalized each year. But we found that 56% of the people who ordered Aware and Care Kits had had a hospital stay in the past year. And to us, that's how the people knew that they needed the kits. The people who ordered them were getting prepared for their hospital visits. So maybe they had a surgery coming up, some other thing where they knew they might need it. And so, you know, now is the time to get your kit if you have a planned visit coming up. Even if you don't have a hospital stay on the horizon, it's good to order your kit now because, as we'll see in a minute, it includes a lot of information. So we really want to take some time to review it all with your family if possible. So again, great that we have some people who don't have PD on the line with us today. It's important for everyone involved to understand all of the information and to be able to reach out to your local Parkinson's organization with any questions, so you can really be your own best advocate. So Aware and Care, you know, and our respective organizations, the Parkinson's Foundation, the Parkinson Society, Southwestern Ontario, are here to help you be the best advocate for your own care. We've tried a couple approaches with the Aware and Care initiative over the years. And really the most successful so far has been what we're doing here now, to put the kits into the hands of people with Parkinson's and families so you can speak up for your own care. And we've also tried, you know, the top-down approach, working with hospital systems and associations. We've worked with the Association of Pharmacists in the US and some others to try and get that information more embedded into the training of those professionals. But really, we've found that the most effective way so far has been to put the kits in the hands of people with Parkinson's. So let's take a look at what's actually in the kit. The bag that it comes in is the number one. You'll see here it kind of looks like a toiletry kit. It's pretty good size to fit all of these papers and other information in there. We also recommend that people always pack their Parkinson's medications in the bag, you know, a spare bottle. You want to make sure that it has your name and the label of the medication on there. You know, it shouldn't be just a plastic bag or some other container. It has to be in the regular medication, the original bottle that it comes in. Because as I mentioned before, some hospitals will not always stock all of the different varieties of Parkinson's medications, and there are rules in hospitals about people administering their own medications, but frequently we've found that it's been okay for people to bring their meds, and then they can give those medications to the nurses to administer. So I'm not particularly sure about the rules in Canada. You can contact Lisa and her team with any questions, but it's definitely good to keep a spare set of meds in that bag for your go bag in case of an emergency. The hospital action plan is this booklet here where you can read about how to prepare for your next hospital visit. It has some information on what to do before the visit, what to do while you're there at the hospital, and what to do after on your way home. And so this booklet is really the reason why it's important to order your kit in advance. If you have an emergency situation, definitely get a kit right away and bring it with you. But it's helpful to familiarize yourself with this. It's about it's a little booklet about 20 pages long, but to just get comfortable with the information and prepare yourself. Another element of the kit is the Parkinson's ID bracelet. So the bracelet goes hand in hand with the medical alert card, which is over here. You can, obviously the text is quite small, but it's a two-sided card and it folds up into the size of basically a credit card that can fit in your wallet, and it has these warnings on here about, I have Parkinson's disease, which could make me move slowly and have difficulty standing or speaking. I am not intoxicated. Please call my family or physician for help. We've had, people call and say, tell us about their interaction with emergency personnel, or even, with policemen just in their general lives, thinking they were drunk when really they have to say, no, I have Parkinson's. The very small text that you can't read down here has the warnings about medications on time, about not stopping levodopa therapy abruptly, some other special warnings. The back of the card has information or space for you to fill out your name and address, your doctor's information, and then again that list of contraindicated medications. And down here below that there are some additional special warnings for people who have a deep brain stimulator. There are some concerns related to MRIs and EEGs and EKGs. So those warnings are all on there. So we recommend that people put that medical alert card in their wallet, wear the bracelet. On the flip side of the bracelet, it has phone number. Ours obviously has the number for the Parkinson's Foundation, and the versions in Canada have a number in Canada for you guys to call. That's if you have any questions, and that's if emergency personnel have any questions. So these things go hand in hand, and it says see wallet card on there. So if you're wearing the bracelet, you want to make sure you have the wallet card for someone to get that additional information. So right now the bracelet looks like this. We have talked about different styles of medical alert bracelets. Obviously it's not the kind that has your, a USB with your medical information right there on it. But for now, this has been the best solution. And again, I'm so happy that we have our helpline for people to call us and give us their feedback, whether it's their unfortunate and scary stories or their really positive stories. We had someone call up who was in a very bad car accident with his wife, and he credits the bracelet for saving his life. He was calling up to get a new bracelet because he was hospitalized and his wife was also hospitalized, and she was not able to speak up for him either because she was actually in worse condition than he was. They saw the bracelet, they found the card, and were able to kind of understand about his Parkinson's, and he was getting his meds on time, which was great, a great response. So moving on, we have the medication form. We've said complete this form and keep copies in the bag. It comes with 10 sheets of these medication forms. These days, a lot of people that I talk to keep their medication list electronically, whether it's an Excel spreadsheet or on their smartphone. If you're comfortable with computers and your phones, that's probably an easier option to make sure it's handy and to update it rather than having to write out a new sheet every time there's an update to your medication regimen. But just in case, we keep this form in the kits and also as a model for you to follow. It has your information on there, space for you to write the name and contact of your primary care physician, as well as your Parkinson's doctor, your pharmacy information, some space for any other conditions that you might have, depression, heart disease, diabetes, urinary incontinence, lots of other things that obviously play into your care. You should have all of that information in one place. If you do decide to use the handwritten form, it's helpful to make copies of it once you've done that, so you don't have to write it out multiple times. You can make photocopies, because likely when you get to the hospital, they're going to ask you for that list. And otherwise, if you keep it on your phone, you could print a copy or have it there handy to show someone. Another piece of the kit, an important one, is the Parkinson's disease fact sheet. So this is a good quick cheat sheet for anyone on Parkinson's disease, but in particular, the idea is that you can ask that a copy be placed in your chart, because up here it has some clinical care considerations. Do not substitute Parkinson's medications. Do not stop levodopa therapy abruptly. Resume medications immediately following procedures. If an antipsychotic is necessary, it shows the ones that are safe. Be alert for symptoms of dysphagia, trouble swallowing, and ambulate as soon as medically safe. So these are instructions for the medical team to help you get the best outcomes. It also lists some common symptoms of Parkinson's disease, of course the motor symptoms, but also some non-motor symptoms that, again, anyone who's not really familiar with Parkinson's disease might not know that depression, anxiety, constipation, sleep disturbances, that those are all quite common symptoms for someone with Parkinson's disease. Down here it goes over the typical Parkinson's medications, and on the flip side, again, it has that list of the medications that are safe and those that are not safe. And lastly, these two pieces, the I Have Parkinson's reminder slips, this one over here on the left, you just fill in your name, important things to remember. It has that same list of care considerations, and when I talk to people with Parkinson's, when I'm out at events, or when I'm talking about the kit, I say, give this sheet to everyone you encounter. It comes in a pad that has 50 or so of those slips, and I say, give one to the doctor, give one to the nurse, but give one to the guy who comes in to take out the trash and the person who's delivering your meals in the hospital, because every single person who's at all involved with your care needs to be aware that you have Parkinson's and about the importance of medication timing. And the magnet can be used to display a copy of the medication form or that Parkinson's disease fact sheet, or it can be for your fridge, whatever you want. But these are the core elements of the kit. Now that we've reviewed all of that, I'm going to give my voice a break for a second and get some feedback from you. Hopefully you're excited about the Aware and Care Kit, and I'll turn it over to Lisa again for another poll.
Okay, thank you, Vaughn. Just another quick poll. If you could please take a couple of moments and respond. We want to know how interested you are in receiving an Aware and Care Kit of your very own. So if you could please select one of the responses. Definitely, I am already on the list. Yes, I plan on ordering one after the webinar. I am undecided, and no thanks, or not applicable. If you just can take a few minutes or moments here to vote. And we have closed the vote, and our results are 43% definitely interested and are already on our list to receive the Aware and Care Kit. 36% yes, I plan on ordering one after the webinar. We have 7% that are still undecided, 0% at no thanks, and 14% of our attendees today are people that don't have Parkinson's. Thank you, everybody. That was our last poll, and I'm going to turn things back over to Vaughn now.
Okay, thank you. So for those 7% of you undecided, let's see if we can change your mind here. Now that you know what's in the kit, we'll walk through some steps to take before, during, and after a hospital stay to help you get the best possible care. And these steps are in the hospital action plan, so you'll have a head start on the information once you get your kit. The bottom line here is that you are the expert on your Parkinson's. So if you're a person with Parkinson's, if you're a care partner, you're there living with it every day. You know your Parkinson's, but you also know any other conditions that you have. You know your unique combination of prescription medication and over-the-counter drugs that you might take. And so you need to use all of that information that you have as well as your kit to be your own advocate. So some of these are going to be pretty straightforward, but I think it helps to really remind people of them to make sure that you're prepared. So line up help, your care team. As a person with Parkinson's, as a care partner, you are the center of that care team. If you have multiple care partners, that is great. Your family, your friends are right there with you. And the Parkinson's Foundation has long been a champion of the interdisciplinary care team model. Mentioned before, that the team is not just you and a doctor or you and your neurologist, but the nurses, the speech pathologists, the occupational and physical therapists and social workers, all of the other people who hopefully you've encountered in your Parkinson's visits play an important role in your care. So it's important to know your team and to have those people, you know, as you're going through your journey with Parkinson's in general, but to know who you might need to reach out to in the event of a hospitalization. So pack your wear and care kit. That makes sense. Review the materials to know what's in there. So to know that you have that pad and you can rip off the reminder slips to hand out to everyone who comes in the room. It's helpful to add an emergency contact list to your kit. Again, an extra supply of your Parkinson's medications with that medication form and a healthcare proxy card, or we call that in the States. If you haven't done so yet, this might be a good time now to work on some advanced care planning. You can work with a lawyer to create an advanced care plan and have those official documents in place, and it's helpful to have those in the Aware and Care kit. In the case that you're not able to speak for yourself, you want to make sure that you have someone who you're confident in them making decisions for you. Prepare for the unexpected. That's, I guess, underscored by this kit in general. Wear your Parkinson's ID bracelet. Some people don't like to wear the bracelet if they're not open necessarily with the whole world, the whole community about their Parkinson's. But it's very helpful to at least put the medical alert card in your wallet, in case of an emergency, somewhere where people will check, and to establish and share an emergency plan. So, in case of an emergency, maybe you're with your care partner, or maybe you're not. And so, in the case that you're not, if that person gets contacted, leave the Aware and Care kit in a particular place in the homes where someone knows where to find it, and then to be able to bring it and meet you at the hospital in that situation. So it, it brings up the Aware and Care kit is not just the kit itself, but it is really hopefully will help prompt you, if you have not yet done so, to make some of these other plans for your life in general. That can be sometimes a little difficult to have some of these conversations, but in the case of an emergency, in the case that it is needed, you'll be so grateful that you've done it in advance. Another step is to find a good hospital. So don't be shy to contact local hospitals and ask questions, and try to select a hospital that will meet your needs as someone with Parkinson's. So I don't know exactly the situation in Canada, but I assume that it is similar to the case here in the US, that many people travel great distances a couple times a year to see their neurologist. Or the hospital or clinic where you see your Parkinson's doctor might not be the closest hospital to where you live in the case of an emergency. And so, most of your primary care or your other visits might be done much closer to home, and that might include, emergency care. And so, not that you'll always have a choice if you're taken in an ambulance, for example, to what hospital they bring you, but if you are in a situation where you have an option, it's great to have done some of that research, to ask them questions and find out a little bit about their services and their personnel, to see where it might be best for you to go. And again, even in those hospitals that do have a top-tier Parkinson center, to make sure that your Parkinson's doctors are notified in the case of an emergency, because those lines of communication are not always open. So that's kind of included here in this Be Vocal. I want to add another bullet that says make sure that someone contacts your Parkinson's doctor if you're admitted to the hospital. Make sure that the people who are treating you are able to have at least a conversation with someone who is familiar with your Parkinson's and your care. But again, just speak up. Even Parkinson's aside, some of us are more outgoing, some of us are more comfortable being public speakers, and some of us aren't. But in this context, it is particularly important to speak up, or to have one of your family or friends who's there with you be able to speak up on your behalf, and to be competent and knowledgeable about your Parkinson's to be an active participant in your care. So you can use the Parkinson's fact sheet, you can use the reminder slips, and the bottom line message is you need your medicine on time, every time. And again, be persistent, kind of goes right alongside be vocal. Talk to each member of the care team about your symptoms and special needs. Although we hope that it's true, don't assume that every member of your care team is talking to each other. People are busy, and depends on how many patients might be on the floor at that time. So it's really important for you to keep reminding them of that. Ask for help if you feel that no one is listening. And so there are various places you can go, to the nurses, to the doctors, to other people on the unit as needed, but to make sure that you don't give up if you feel that they're not listening. Go to the next person, go to the person above them, be vocal and be persistent, because it obviously can have severe consequences if the care that you're receiving is not optimal. And that just goes, again, one more plug for having a care partner or some companion there with you in the case of a hospitalization. It's important to have that person there with you in general doctor's visits anyway, to help take notes, to help give observations about what's been going on in day-to-day life. Again, you have, you and your family are together 365 days of the year, and you're with that Parkinson's doctor once or twice. So you have this whole breadth of knowledge and experience living with Parkinson's day to day. It's helpful to have someone else remember all the myriad things that go on in your life, and it's particularly important in the case of a hospitalization, to help remember, to help take notes, to really understand what's going on and be able to speak up. Get moving. So that's kind of the third message of the Aware and Care Kit. The top two are meds on time, every time, and then no contraindicated medications. So the right medications on time, every time. And the third piece is to get moving as soon as possible after a procedure. And here in the US, we remind people to ask for physical therapy in the hospital and to find out if you qualify to receive therapy at home once you're discharged. I think you might be a bit luckier when it comes to that, when it comes to physiotherapy in the hospital. So it's my understanding that you will be referred to home and community care for your physiotherapy and other care at home after discharge. But certainly if you have any questions about that, contact your local Parkinson's organization. But before leaving the hospital, you'll want to make sure you have all the details about that referral, so it can happen promptly when you get home. And stay on top of your care, step 8 here. This is, again, I feel like I sound like a broken record, but it's only because it's so important to have that team around you. Not everyone has a spouse or a close care partner, but whether it's a family member or a friend or a team of those, really. It's helpful to have a few, a core group of people who understand what you're going through and are able to speak about it and to speak up if you think something is wrong. That goes back to those calls we get from the hospital, people saying, I need more reminder slips, or my doctor didn't believe me, but this is what happened, and this is what I need, to know the medications that are unsafe, to at least have those floating in the back of your brain so you can reference the Aware and Care kit materials and show them to the doctors there. Another thing we've heard is that they didn't believe me when I said it, but then I showed them this piece of paper that has the National Parkinson Foundation logo on it, and then they said, oh, okay, it had the references from the peer-reviewed publications on there, and then they believed it. So hopefully we want to think that our healthcare providers will always take our word for it, but it's just nice to have the backup. Finally, for these steps, it's helpful to contact your Parkinson's doctor and share your discharge instructions. So again, you want to let your Parkinson's doctor know that you've been hospitalized, and then again, let them know the instructions, and you can ask for their feedback and any insights they might have into what you should do going forward. But you can also contact the hospital and let them know about the quality of care they provided. And this is helpful both if it's been a positive experience and if it's been a negative experience. So we had one of our centers of excellence who was trying to reach out to their local hospitals and their affiliated hospitals to increase the education for the staff on Parkinson's disease. And they said, no, we don't really see Parkinson's patients here, and when we do, we always give their meds on time, so it's no problem. And she kept checking in, and they kept blowing her off until they got a couple of complaints, and one of the complaints happened to be from a high-profile patient, but still they got a couple people called up and told them about very negative experiences they'd had as someone with Parkinson's in the hospital, and only then did they really listen. So your voice matters. Your voice is really important, both in during your stay and then after. And it's even better if they did a great job and you're able to provide positive feedback. That's always nice to receive too. And last but not least, help connect with others in the Parkinson's community. That's what you're doing by being on the line right now. If you need a local referral, hopefully the Parkinson Society Southwestern Ontario can help you out with local support groups. It's always helpful and frequently comforting to find other people who know what you're going through and to be able to share these stories and share your tips and experiences. So, when should I use the kit? In a planned visit, an emergency visit, annual check-in with your Parkinson's doctor. Your doctor might not know about the Aware and Care kit since it's relatively new to Canada, so share it with them. Let them know about it, and let them know to share that information with the rest of their patients for them to order their own kits. It's also helpful, we've gotten, this was designed for hospitalizations, but we found that people are using the kits in rehab stays, in assisted living, anywhere where someone else might be administering medications for you. It's important to share and bring the kit in that setting. So again, this is sharing, telling others. If you have a support group, let others know how to order their own kits. On awareandcare.org, we have a version of this presentation that lists the kit contents and those 10 steps to optimum care that's available for anyone to use, so you can have a discussion about hospitalization experiences and the Aware and Care kit. We have resources on there for people with Parkinson's, for caregivers, for healthcare providers, for support group leaders, and of course your local Parkinson organization is always a great resource. Finally, in closing, you might have heard of Atul Gawande. He's a surgeon and an author. He's written several books on the process of care in general in our healthcare system. But he wrote, if someone discovered a drug that could cut complications with anything like the effectiveness of the checklist, we would have doctors clamoring for it, hounding their hospital administrators to get one for them, because, damn it, he was passionate about this, doesn't providing good care matter to those pencil pushers? This is from his book, The Checklist Manifesto, that showed that just even simple checklists, which they use in aviation and other industries, could greatly improve outcomes in the hospital and dramatically reduce risks. And so he found that the surgical checklist reduced complications by 36%. But this is the take-home home run message here. Delivery of Parkinson's medications on time actually reduces complications 47%. It's a huge number. It makes a dramatic difference in care. And so I hope that through this presentation, you'll be inspired to get your own Aware and Care kits and learn more and be comfortable talking to anyone you encounter in a care setting about the importance of Parkinson's medications on time and about your needs. So thank you so much for allowing me to speak today, and hope you have a great day. If there are any questions, I can answer them.
Thank you, Vaughn, for this informative presentation and sharing with us the Aware and Care initiative. I know I, for one, am very excited for this to be available here for people living with Parkinson's. Any of our attendees, if you do have any questions, you can type them in the chat box, and Vaughn would be happy to answer them. Other than that, Vaughn, thank you again. You have provided us with the information, resources, some great tips and tools to prepare people with Parkinson's and their families for hospital visits, whether they're planned or not. And just a reminder for our attendees or our viewers today, the Aware and Care Kit there's a cost of $50, or if you are a Parkinson Society Southwestern Ontario member or monthly donor, the kit is available for free. There is, however, a shipping cost of $15, or arrangements can be made for you to pick up your kit at the local office or at one of our upcoming events. If interested and you have not yet ordered your Aware and Care kits, please call us here at Parkinson Society Southwestern Ontario. The number here is 1-888-851-7376, or you can email us at info@parkinsonsociety.ca for your very own Aware and Care kit. If there were any questions, we're happy to answer them now. Vaughn, I think you're off the hook. I don't believe there are any questions for you. I think you covered it all.
Oh my God. Well, thank you for the invitation, and thank you everyone for your time. And I hope you get your kits. Get your kit, know the facts, be aware and care.
Okay. Thanks again, Vaughn, and thank you everyone for attending today's webinar. We hope that you enjoyed it and that you will join us for our next webinar coming up on Wednesday, June the 14th, and the topic will be on medical marijuana. Thank you, everyone.